Good evening. My name is Dr. Jessica Israel, and I am the Senior Vice President for Geriatrics and Palliative Care here at RWJBarnabas Health. It's my pleasure to welcome you all to tonight's webinar, Holiday Celebrations During a Pandemic, a practical guide to keeping your family safe. Also, my pleasure to quickly introduce my colleagues who will be helping me tonight answer some of your questions about this issue, Dr. Lincoln Miller and Dr. Naalla Schreiber. So I'll begin just by kind of laying out what to expect during the webinar and a couple of introductory thoughts and disclaimers, and then we'll really dive into the questions that you are all looking for the answers to. So essentially, I'm going to start, and then I'll introduce my colleague, Dr. Miller, who will answer some more specific questions related to infectious disease. And then I'll introduce my colleague, Dr. Schreiber, who will talk more about anxiety, about how to emotionally cope with some of the things that we're going to talk about tonight. This is a really difficult and unprecedented time for all of us. So let me start by saying that while we're going to attempt to answer some common questions that I'm sure you have and that people have asked us, there won't be a one-size-fits-all answer for some of the things that we will be talking about tonight. The answer really is individualized based on what the guidelines are from our state and what your own personal circumstances within a particular situation. So I can start by giving an example of that. So being a practicing geriatrician and just being a person who has friends, right? People call all the time and say, do you think it's safe for me to do blank, right? Is it okay for me to go to this event? What do you think about the holiday coming up? And we're going to spend a lot of time talking tonight about Thanksgiving because it's next week. But what we're going to talk about applies to a lot of the things that we're going to face as a collective community over the next few weeks and month and a half. Usually a really festive time for all of us when we get together and really share wonderful experiences. It's going to be a little bit different this year. So I tell people, when you're thinking about, for example, should I attend Thanksgiving dinner? You have to think about there's three different questions you need to ask yourself. So the first is to look at your own personal situation going into that event. What is your personal risk, right? If you went to an event and were, let's say, exposed to someone, do you have some of the risk factors that would make a disease more significant for you? Are you older than 65? Do you have diabetes or heart disease or something that compromises your immune system? Beyond yourself, do you live with someone who has any of those issues? You may be a relatively healthy person without risk factors, but if you live with a 91-year-old mom, then that has to go into your equation as you think about the event. The next part is to think about the event that's in question. What's the significance of this event? How important is it? And are there alternatives? And we're going to talk about that, especially when we get to Dr. Schreiber's portion. Are there alternatives to what it is you're planning? And the third part of that would be to look at, okay, if I go to this event, who's going to be there and what kinds of rules have they been following? Are you going to be going to an event where people have been masking and have been staying out of crowds and social distancing and have been careful? Those three pieces are part of your decision, and they help you to decide what it is you're going to do. And again, it's not a one-size-fits-all situation. So I can walk you through my personal example about Thanksgiving. So I am thinking every year, my family, we alternate Thanksgivings, and this year would have been the Thanksgiving at my house. The last time I was at my house, I had 28 people over for dinner. So that's a big event. That's something that we can't do right now with the limitations on people in the home, but it's something that I have to think about. How am I going to do Thanksgiving this year? So I think about my own personal risk. So I'm 52, I'm relatively healthy. I think that, so for me, my risk of acquiring the disease, if I got the disease, hopefully wouldn't be horrendous, although no one knows that. But I have a sister with a serious illness that could compromise her immune system. So it's not just me I have to think about the people in my environment. Then I think about Thanksgiving. Are there other ways that I could share this time with the people that I love? And that answer, I know, is yes, right? There are ways to be creative, and there are ways to spread out something over a period of time, being with people in smaller groups in safer ways. The third thing is to look at who's coming to the event. So if I had Thanksgiving at my house the way that I normally would, I think there would be people coming from at least 5 different universities, coming home from university and coming into that environment. So technically, although I hope all of my kids and nieces and nephews are following all the rules, they're coming from higher risk environments. So I would be bringing people, and maybe people who are at higher risk, into an environment where I'm introducing risk, right? When you think about who's at an event. So at the end of all that, it leads to a decision that this isn't the year to do a big Thanksgiving, that this may be the year to get a little bit creative with how we put that together in order to keep everyone involved safe. So it's my own personal example, but something that as we talk tonight and as we go through some of these questions and scenarios, I'm going to encourage you to think about for yourself. Again, what's the risk to you and your immediate family and pod? Sometimes people refer to it as. And then what's the event? How could you do it differently? And then finally, if you do have this event, who's coming? And what's the risk there? And maybe how can you mitigate those risks? So we'll start with really that introduction, and then we'll move into a little bit more detailed discussion. We'll start with Dr. Miller, who is the section chief of Infectious Disease at RWJBarnabas Health and the St. Barnabas Medical Center. So welcome, Dr. Miller. I'm excited to hear what you have to say tonight.
Thank you, Dr. Israel. Well, welcome everybody. And I'm going to say a few things about where we are in terms of the pandemic. It looks like we're having a bit of a resurgence again in New Jersey, but we did get through a very difficult first part of the year. And now as it gets colder, and as Dr. Israel mentioned, we're thinking about going back inside, getting together with our families, and we have seen an increase in a number of cases lately in our neighborhoods and in our counties and in our communities. So I before we talk specifically about certain particular agenda items, I just want to say there are some hopeful signs that we have 2 companies that have come up with what look like potentially good vaccines on the horizon. And we're excited about that. That's not going to be available for now for a couple of months, but we do think that that's going to make a big impact. But while we're waiting for the vaccines to become available and distributed widely to our citizens around us, it's important, and I'm going to echo some of the things Dr. Israel said. When we have get-togethers, it's so critically important to think about how to do it, and you have to consider your neighbor and your family members, and everybody has different degrees of risk for COVID, and we certainly want to mitigate those risks for our vulnerable relatives and particularly older members of our families that are going to be present with us during the holiday season and stuff. So I want to just start and just focus a little bit on mask usage, because I'm a big mask person, and I really think this is the way to get through this. So I'm going to put this on and show you really how I like people to do it. So you have the top part that has, usually if it's a straight surgical mask, a flexible component with a little bit of metal in it that can kind of fit over your nose. And then you put the ear straps over your ears, and you want to just make sure that your mask is covering your nares and you have a good contact with your upper part of your nose, or that flexible part, and make a good fit. And then make sure that you keep it above your nares. You see some people walking around like this. That's not good, obviously. And that it fits over the bottom part as well of your chin too. So you have like a reasonably nice seal. And it's a good idea to practice wearing it. I find that the more you do wear it, the more comfortable it becomes. I personally think that this general surgical type mask is most comfortable, or the other ones are a little more fitted and constraining. And having to wear a mask, I feel more comfortable wearing this throughout a good part of the day. Important to remember when you take it off to lift it away from you, and we don't want to have any contamination. That if you put it in a clear Ziploc bag. You can reuse them and stuff. You obviously don't want to reuse them when they get contaminated, but you can certainly use one for a couple of days, basically, until you get it contaminated and put it away and stuff. But that's kind of really sort of the bread and butter in terms of mask usage. It's really, really critically important. And when you leave your home environment and go out into the world, it's really an essential piece of equipment that you need to bring with you, basically, where you go around and stuff. So that's a really, really important piece of it. And I'll just echo some of the things that Dr. Israel said as well, too. The importance of social distancing and social encounters and how that's impacted upon. Well, really want to socialize when you can and keep a mask on for as long as you can, basically, and stuff. And so this comes into play when we're talking about getting together with the people in your world. So I want to say a few things about that. It's knowing who your family's been with and who you've been with. And you really sort of want to try to define your world as best you can. So I like to think about it in terms of like a planet or solar system where you have like, one main sun or planet, and you have all the other planets that are sort of circulating around you, and you sort of want to keep track of everybody. You want to keep track of your kids, who they're going around with, and everybody's got their lives, and we all have children that are in and out of school and on further than that with jobs and relationships, and they encounter different people, basically. So you really want to try to keep tabs on what everybody's doing and who they're seeing, and be sort of conscious of that when they come back to the house, because they can be bringing, COVID. Obviously, we know it can be transmitted asymptomatically to your house, and you want to make sure that people are, taking the necessary precautions. So that's one thing. So be aware of your family and who they've been around is a really critically important tool. And sometimes when people have traveled outside of your community and into another neighborhood or another state or city, and they've had exposures, sometimes it's necessary to get people tested before they come back in your house and stuff, depending on if they've been around somebody that may or may not have been positive. So that's something to keep in mind too, but very, very important in terms of bringing people into your house, knowing where they've been and who they've been around. So those are some important sort of basic things. And I think I'll stop here and I'll let Dr. Israel ask some questions that are more specific about some of the more important questions you may have.
Great. I think that that was super important information. I think that because we have all been dealing with this for such a long time, we have a little bit of fatigue in kind of sticking with the mask wearing and the social distancing, and people get tired of it. But especially with the resurgence of cases, it's so important to go back to basics, and those basics have been shown to protect us and make a difference. So thank you for that. I'm wondering if you have any tips for how to not make your glasses fog if you put the mask on. But let me ask you some more important questions than that. So these are some commonly asked viewer questions. So the first one, and I get asked this all the time, you probably do too, is I was exposed to someone who has COVID and I have no symptoms at all. When is the best time for me to get tested?
So that's a really, really good question. I'm glad you asked. And let me just say, well, what does an exposure mean? So, there are different working definitions that have sort of been modified and changed by the New Jersey Department of Health and the CDC. But the current one basically is an exposure to somebody generally within 6 feet apart for a cumulative amount of time for up to 10 or 15 minutes constitutes an exposure. And it really determines your risk with that type of exposure on whether or not you're wearing a mask. So we spend a lot of time thinking about this in the hospital. But for most people, if you are in a social situation, particularly a party, a restaurant, across the table from somebody, if you're not wearing a mask, when the mask is off, you're really vulnerable. I think that's really something to remember and stuff and keep in mind. And that's why social settings, although we're all drawn to them and gravitate toward them and want to have them, are areas of high risk. I mean, they certainly are and stuff. And, today the governor made recommendations for limiting our social gatherings to 10 or less in the homes, because we feel now that with the mask fatigue that Dr. Israel mentioned, that people are not being so careful. And this is really driving the epidemic and stuff. People are getting together. There's this tremendous need for us to have contact and closeness to our loved ones and friends, but this is really kind of causing the resurgence, basically. So really, really important to keep that in mind. And I can't say don't take off your mask entirely when you go to social settings, but that's when you're going to be most vulnerable and stuff. So a typical scenario that I hear from colleagues and friends often lately is, oh, gee, I was at a party last week and Mrs. Jones turns out to be positive. And I'll say, well, did you have contact with her? And I said, yeah, I talked to her. We had a drink or something. We were standing, more than 6 feet away from each other, but maybe a little closer for, 5 or 10 minutes. That's an exposure. That's definitely an exposure. So what would be a good time for this person with that kind of exposure to get tested? So we now think about the average time of incubation of the virus is up to 14 days, but the sort of median period of infectivity where people tend to show symptoms or not is about 5 to 7 days. So if you've had a definite exposure, we like to think that that's really the way to go. So you should get tested, but not the first day or the second day. Try to wait day 5 to 7. That's really kind of optimizes your chance of catching the virus with our, sensitive and specific PCR tests. But you want to do it in that window period. So 5 to 7 days after the exposure would be the optimal time to get the test. And it's very important to think that, while you're doing this, if you are a high risk exposure, and that person that I described would be, you have to be aware of your family again. So you have to really isolate and quarantine from your loved ones during that time. That's the hard part. I went through this a couple months ago after I was exposed to somebody in a business meeting. And, it's not easy to do, basically, but you walk around your house, you keep your mask on, and, your family needs to remind you to do that, obviously. And then what do you do when you dine with them? Well, if you do dine with them, you really should sit at least 6 feet away and out of range, basically, and just take off your mask when you're eating and stuff. And I think that I like to think about the idea of dining and just taking off your mask when you eat, basically, when you're in a restaurant. But I'm sure we'll get into those questions in a minute and stuff. But so you would do the social isolation and quarantine for up to 14 days. And then if you get to day 5 and 7 and you get your test, hopefully you're negative, then you can take a sigh. You're not completely out of the woods, because some people will develop symptoms up to day 10 to 14. But it's a higher probability as you go each day past day 5 and 7 that you're more likely not to become infected with the virus and stuff. So that's kind of how I sort of coach people through it. And then you can go back to your life, basically. And once you're out at day 14 and you don't have any symptoms, and you've had that negative test at day 5, 7, you can generally think about returning back to the fold, basically.
Terrific. You mentioned, but can you talk a little bit more about the safety of dining out? What's really the difference between indoor and outdoor dining, and what do you recommend?
Sure. So during the summer, we were fortunate to have the outdoor dining, and that was a real blessing. And I think it helped keep the rates down, and contingent on good weather, of course. So, places popped up, and the places that are successful at doing this, have adapted to the cold weather climate. So what do I mean by that? So, you have to maintain good circulation outside, obviously, with air. Social distancing. So a lot of places will have sort of little cubicles put up with walls and glass shields, so that your little party and your table and your booth, as it were, is sort of a good model. If you think about a booth with sort of high walls, it's isolated from the next person over, and you have good circulating air around you and so forth. And but when the server comes over to your table, I always tell everybody, keep your mask on, because that person could be a vector of the disease. And generally, good places, the servers are all wearing their masks, but you really should keep it on. You should really keep it on. Order your food, have your food, and when it does come, it's okay to take it off. But what I like to tell people is put your mask back on, as soon as you're done eating. And if everybody else is still eating at the table and you're done, it's better that you have your mask on at that point, really. So outdoor is really much better because there's much better circulating air and we can have the opportunity for better social distancing. And as you know, in New Jersey, Governor Murphy's asked us to have indoor restaurants with only 25% occupancy, but some places are not strictly following that rule. And, they're not all created equally with respect to circulation and separation inside and stuff. So I think I'd be very wary of places indoors. And I personally would rather eat outside with a parka or some warm clothes and make sure that I can keep that social distancing and safety as the weather does get colder. I would prefer that as an option for me and my family, basically, as opposed to indoor dining, which I just don't think is really safe at this time, unless you can find a place where there are just a couple other people eating there with you, and there's tremendous social distancing with sort of a high ceiling and terrific ventilation, but those places are sort of few and far between, unfortunately. So.
A couple of years ago for our family Thanksgiving, I tried to do our Thanksgiving dinner outside. I don't know if you remember, but 2 years ago was the coldest Thanksgiving on record since I think 1915. So we were all bundled up, but it worked, right? So thinking about Thanksgiving dinner, what do you think people should really do about that? I know that we've been given some limits on the numbers of people we can have over, even for private gatherings, but what do you really think?
So you touched on this a little bit before, and I'll go over some of those points again. So I think it's really critically important to try to limit the size of the gathering, and then look at who you're having come over, basically. So again, the same issues that we talked about before. Know where the person was, know where your family was. I mean, if you can sort of even limit your travel and socialization before this social event so that you sort of quarantine before the event is kind of a nice thing for the rest of the people too. But I would definitely would try to limit the number to as small as possible. And I would also encourage, if you have a terrific relative that you're anxious to see that has to drive down from Vermont or come up from Maryland, I would encourage them probably not to come this year. I mean, it's hard to say those things, but I think that, it's in their best interest. And I just recommended this to a colleague the other day, dying to see his family, his close friends. His brother lives in Baltimore, wanted to come up. And, I said to him, well, that's really not a good idea. He has some vulnerable family members. And, the experience of driving, can be risky too. I mean, we know those, rest stops are not the safest places on earth as well. So I would sort of discourage the out-of-staters from coming in. And if you can conceive of a localized Thanksgiving, if you have some family and friends that are very close by in your community that don't have to travel far, that would sort of be ideal with a small group. And I think that's kind of the way to go, basically. I really do.
Great advice. And I like the point you made too about quarantining before an event. I think it's something we should think about as we move through the holidays. The less large group gatherings we attend and the more careful we are about that, the safer we'll be with the people we love, as events come up over the course of the next month and a half or so. Just keeping with one of the things that you brought up, is it safe to travel? What do you think about getting on an airplane, a train? We talked a little bit about rest stops, public transportation. How do people reduce the risk if they're going to travel?
Sure. So, I mean, airplane travel is pretty tricky. It really is. And I've had some of my kids that have been on some planes across to California and stuff. We tried to pick flights that weren't very crowded so there could be some social distancing with the seats. Obviously, you have to be super careful with, good hand washing and Purell and mask wearing and all that. And the airlines are advertising that they're doing a much better job in terms of the air circulation and HEPA filters and things like that to cut down on transmission. But it's a risky venture, basically. It really is. And it's not even so much on the airplane itself. It's the airports, where there's more congestion and you're closer to people and things like that. So if you do have to travel, ideally, if you could swing it so that you're on a plane that's not jam full of people, that you're not sitting so close to somebody. And then obviously sort of expeditiously get off and on as quickly as you can and not linger very much at the airport with the check-in and getting off and getting your bag and moving on and stuff. I think public transportation is tricky, with subways and trains and things like that. I think that is kind of a difficult to negotiate, but very carefully with lots of Purell and very scrupulous mask usage and stuff, and just really try to maintain your social distancing if you have to do that. It's necessary for some people as best that you can. But I think that when possible, if you can drive someplace, certainly you can and limit your own exposure to other people and stuff as opposed to public transportation. So that's a little bit more of a reasonable opportunity if you have that option as well too.
Great. So I think a lot of people tuning in are like me. They'll have college students coming home for the holidays. Do you think do you think students should get tested when they come home? Is there any particular things that in that scenario that students and families should think about to keep themselves safe?
Sure. So that's a really excellent question. And as you know, they're individualized policies that all the universities have and stuff. And some of them are testing once a week. Some of them are testing twice a week. So, I mean, ideally, I'd like to think that, where my kid is that they have a rigorous policy where they're screening and, and you can see how the school is doing with that. So get a little bit of sense of that. But I think, that's certainly a concern, when they come back, and you certainly don't want them to come home and infect grandma and grandpa or you or your wife, for example. So that is a big issue. And, I think what I would suggest is, depending on the frequency with the school to test somebody, ideally, you'd like the person to be tested maybe a couple of days before they come home and stuff. But bear in mind that, it's kind of a moving target. And so that, if somebody's exposed to the virus and they get tested on, say, day 2 or 3 after they're exposed, you can have a negative test, but you can still go on and become infected, 5 to 7 days later, like I mentioned before. So it's not a bad idea at all to think about having some college student, child of yours or a relative that's coming to the house get tested before they come. I think that's a really good idea because it gives you a little bit more comfort in terms of what somebody is bringing to your get together, and as we know, unfortunately, that there are high rates of COVID in this younger population, and a lot of times they don't have symptoms. So I think keep your flags up and your radar up, and be wary of those people, and they have to be asked too about who they've been around and stuff too. So I think that's really kind of important too, and that to be aware. And if there is a little outbreak in one of the schools where the kids are coming from, you want to know, is your child or relative involved? Was there any exposure? And the schools are doing a good job keeping up with that, but you want to ask the kids too. So make them ask questions about themselves and their goings and comings, and see if you can try to increase their level of self-awareness about who they've been around. I think that's a good bit of advice as well.
It's great suggestions. Thank you. We are going to shift a little, and I'm going to introduce Dr. Schreiber, who is a psychiatrist with RWJBarnabas Health Medical Group and the director of home care psychiatry for the Visiting Nurse Association in New Jersey. Dr. Schreiber, do you want to give a couple opening remarks? And then I have some questions for you too.
Please. Thank you so much, Dr. Israel. So I want to start by saying the obvious, right? COVID has disrupted all of our normal rhythms of life. People who used to go to work every day are either working from home, remote work. Some people have lost their jobs. Kids who used to go to school every day are at home doing Zoom, sometimes not so well, especially our younger kids. College students, some of them are at school, but some of them are at home and working from home. Families are really cooped up right now, and especially our families that live in smaller homes or in apartments, people are just on top of each other in a really uncomfortable way. Our social connections have all been disrupted. Grandparents are often not seeing their adult children or their grandchildren. People are lonely. Even worse, people have lost loved ones. And there are those of us in the community caring for loved ones who have after effects from COVID. People have huge financial strains right now from loved ones being out of work, or again, all that sick care. So life is stressful, right? And people are experiencing heightened levels of anxiety. And it's not just for us here in central New Jersey or even in the United States. This is happening globally right now. A recent publication from the Center for Disease Control looking at mental well-being in the US in June, so pretty recently, found heightened rates of anxiety, depression, substance abuse, unfortunately, and even suicidal ideation. And interestingly, the people that were most affected were those of us who are middle-aged, who are sandwiched in between elderly relatives and our own either children or young relatives we're raising. And this is exactly what I'm finding in my work when I go into people's homes at Visiting Nurse Association, or even in my work here in my outpatient work at RWJBarnabas. And yet there are so many things we can do right now to combat this disruption, right? We can create new and more healthy routines in our life. We can focus on self-care and find ways to soothe ourselves, our bodies, our minds, our spirits. We can seek out creative ways to connect. These things take an initial investment. They take time, they take mental energy, they take imagination. Sometimes they even take money. But once you create a healthier, kind of more well-rounded new normal, people should hopefully feel less anxious and less stressed out by all of this. So I know you have some questions for me now.
I do. I'm reminded of a cartoon I saw recently where there was a patient on the couch in the therapist's office, and the therapist basically dropped his notebook on the floor and said, "Move over," and got on the couch next to him, because there's so much anxiety just across the board without with COVID and not having clear answers to our questions and clear answers to when will this end and all of that. So my first question is it's a broad one, right? How about some coping advice? How can we cope with where we are now and the uncertain future? What do you suggest?
So I think we're all struggling with how to cope right now in our own ways. As I just said, you really need to put in place active coping skills. You need to work at it. You need to plan time into your schedule for friends and family. You need to cultivate hobbies and interests that are kind of COVID safe. You need to focus on the big picture so you don't get lost in all of the little details that are very annoying right now. If the news is stressing you out, you need to stop watching it. It's sometimes easier to get your news in print. It's less sensationalistic and creates less anxiety in people. If social media is stressing you out, you need to unplug. You need to spend an hour or two at night where you turn off all your social media, or even take a weekend off where you don't do social media. All of those things can help you cope with the pandemic.
Mm-hmm. That's great advice. Can you talk a little bit about why self-care is so important?
So let's talk about what self-care is.
Good.
Self-care is everything we all do on a daily basis to take care of ourselves, right? That includes taking care of your physical body. That includes maintaining emotional health. That includes feeding your psyche, so that cognitive thinking part of your brain, and that includes feeding your spirituality. And self-care is so crucial because self-care is the way we pause, we recalibrate, we step out of the rat race, and we focus on the things that are really important to us.
Great. I feel like it can't be emphasized enough. It's so important that we take those moments, especially now, but really all the time. Can you touch on some things people can do from your view to take better care of themselves?
So you're gonna laugh, I'm a psychiatrist and I'm supposed to take care of people's minds, right? But your mind is housed in your brain, and your brain is a very complicated organ that lives in your body, right? And they're not separate. So the first way we take care of ourselves, that first part of self-care, is actually taking care of our bodies. Mm-hmm. And that starts with what we put into our bodies, so what we're eating. So many of my patients have gained 5, 10, 15. I have people that have gained over 20 pounds since COVID started because they're sitting, they're not moving, and they're eating. They're snacking, they're grazing, they're eating all these unhealthy foods. So it starts.
They're gaining the COVID-19.
Yes, exactly. It starts with people eating healthy, nutritious meals, fruits, vegetables, proteins, not picking out on the pretzels, the chips, the cookies, the candies. All those things spike your blood sugar and then it crashes. And when your blood sugar crashes, people feel lethargic, they feel dull, they feel numb and foggy. It doesn't actually help them feel better. So starting with what you eat is important, okay? But then we have to talk about our health, right? People need to see their doctors, even if it's just a video visit. They need to get their prescriptions renewed. They need to stay on their supplements, right? There's all sorts of supplements people take for mental well-being. Exercise is so crucial. We've all become couch potatoes. People need to move. Exercise helps your body. It helps you sleep better. It improves your mood. It clearly improves your physical health, right? And then there's sleep. So many of us have lost our regular routines. We're going to bed too late. We're not letting ourselves get enough sleep. So part of all of taking care of the body is creating these body-friendly routines where we have regular meals, we have snacks, we have bedtimes and wake-up times. But then we have to feed our soul, right? So that's hobbies. So hobbies can be things like arts and crafts, right? So for people that aren't very creative, they can do color by numbers or stickers by numbers. For the more creative folks, there's adult coloring there. And for the downright crafty, there's needlework, sewing, clay making, pottery. There are puzzle books you can do, right? Sudoku, crossword puzzles. You can play games like solitaire, good old-fashioned card decks. You can do it on the computer as well. And then, of course, there's wonderful fiction out there that you can just escape from all of this insanity. I'm personally reading a great Baldacci book right now. Then we need to feed our minds, right? We need to keep ourselves intellectually alive. This is especially true for people that have lost their jobs or people that are busy homeschooling young kids. Okay, so nonfiction books, reading nonfiction or even self-help books. It's a wonderful time to read self-help books and really work on yourself. There are so many online classes through colleges, through universities, through online companies like Coursera. You can take time to learn a new language. I have a patient right now that's learning Spanish. There's Rosetta Stone, Babbel. Some of the libraries even have free courses for people through their public libraries. There are great TED Talks out there. There are skills groups like Toastmasters to learn public speaking. Many of them are meeting virtually. This is how we provide self-care for our bodies, but also for our minds.
Those are great suggestions. What about when we're thinking about getting together and alternate ways to do that? What are some of the ways that people can connect with each other if they're not in the same place?
So for those of us who have smartphones or iPads or tablets with video cameras, there are so many video applications out there right now. WhatsApp, Skype, Zoom, FaceTime, Duo, right? You can always arrange a date with one of your friends, right? As an adult, right? I call it my adult play date, where I'll have a girlfriend and we'll Zoom together, okay? But you can also be creative about how you do those Zooms, right? So you can have a happy hour and everybody brings their favorite alcoholic drink and they kick back and drink. For those of us that don't drink alcohol, you can have a coffee hour, right? Where everybody brings coffee or tea. You can even plunk a computer down on your Thanksgiving meal and you can Zoom in or Skype in your elderly relatives for whom, as we've just heard, it may not be safe for them to be at a Thanksgiving meal with all of those college students, right? You can do all these activities on video platforms. My mom hosts an art project with all the grandkids in the family every Sunday where they get together and do an art project together. You can share poetry. You can make music together on Zoom using instruments or voices. You can have a Zoom talent show. You can do a scavenger hunt on Zoom. You can play games, bingo, charades. There's a bunch of games that lend themselves to video platforms. And then for especially some of our older relatives who don't have video capability, there's telephone and there's good old-fashioned US mail. When I was growing up, I had pen pals all over the world. You can send mail back and forth to people. You can even do an art project or a collage where you send it back and forth. So there are all these creative ways when we can't be together physically in person that we can still be together emotionally.
Those are great ideas. I love getting a letter in the mail. I can't remember the last time that I got a letter, but what a great idea. So much of what you're saying is inspiring me. My friends are going to have to look out now for the talent show that I'm going to stage virtually. Last question for you. What are some strategies that people can incorporate into their lives to reduce anxiety if that's something that they're feeling now?
Great question. So the first thing we have to do is get our anxiety out. Anxiety eats at us. We ruminate and think, and we just can't move beyond it. We have to get it out of ourselves. So you can talk to a friend, a spouse. If you're religious, you can talk to a clergy member, like a pastor or a rabbi. For people that are in support groups, whether it's a grief support group or a support group for a certain medical condition or even a 12-step group, right? You can talk to the people in your support group, or there are people who need a therapist to talk to. But there's also other outlets for getting your anxiety out. There's journaling, right? I personally journal on a computer, but some people do it pen and paper as well. You can also do it artistically. You can make a collage of how you're feeling, right? Or paint a painting or make a drawing that expresses how you're feeling. So then once you've expressed it, how do you cope with it better? So I'm a big believer in meditative practices as a way to cope with anxiety. And basically what meditative practices do is they teach us to sit with it and realize that it's not going to kill us, that we can live with it, process it, and move on. So there's all sorts of ways you can learn either mindfulness meditation or formal meditative practices. Books, apps, videos, tapes, right? There's many ways and many different flavors of how to do this. There are body scans. There's also moving meditations. So for people who don't like to sit still, right? There's Tai Chi, yoga, Qigong. And again, with YouTube, you can find this stuff for free on the internet. Then there's the psychological perspective, right? We all have to have a healthy perspective on what's going on. That starts with focusing on the positive. It's really easy to get bogged down in all the annoyances of COVID-19 and everything we cannot do. But that just makes you miserable, angry, frustrated, and anxious. So sometimes you have to take a step back and say, whoa, what's going right in my life? What's okay in my life? And I find the best and most concrete way to do that is through gratitude lists. So whether you literally type it out on the computer or you write it in a journal or you tell it to a friend or you say it in a prayer, concretely listing out the things you're grateful for can be really helpful. I also love, for people that tend to be more overwhelmed kind of acutely by anxiety, I love coping cards. So this is literally like a 3x5 or a 5x7 card that you can decorate if you want, if you're crafty, right? Where you write, if I'm anxious, I will, on one side. And the other side, you write 1 through 5. And you write down specific concrete coping skills that you're going to use. So it's not, I'm going to call a friend. It's, I will call Christy or Marcia, right? It's not, I'm going to have a snack. It's, I will drink a cup of herbal tea. It's not, I'm going to exercise. It's, I will walk around the block for 10 minutes. So these are very concrete, specific things that you can do. And then when you're feeling anxious, you pull it out and it reminds you, oh, I have these healthy coping skills I can use to cope. There's also taking the big picture perspective, and you can do a circle of life. I know that's not the theme song from The Lion King that I'm talking about. It's literally this psychological concept that we all have domains in our lives, like romance, like work, like hobbies, right? And some of us are more fulfilled in one domain and not another. So you can literally graph one of these things out. Again, just go to images on Google, you can find this, and you can realize what's missing in your life. And then you can actively work to put those factors into your life to kind of round out your life. Or you can do a vision board. It's kind of this, idea. So I know for me, when I start getting bogged down, and I listen to people's problems all day long. That's my job, and I love it. Okay, but I have to maintain my own healthy coping skills so I don't get bogged down in everybody else's anxiety. So I take a step back and I remind myself, look, I'm healthy. My parents and my in-laws are alive and healthy. My marriage is doing okay. My kids are all right. I have a meaningful job that I'm employed in. So many people don't have those things right now. And when I do that, I'm like, okay, I refocus on what really matters. And then clearly, if none of this stuff is working and you're racked with anxiety or racked with depression, then maybe it is time to seek professional help. And professional help can be a therapist, and that can be a social worker, a mental health counselor, a psychologist, and some psychiatrists still do, psychotherapy as well. Or some people need medications, and that can be from a primary care doctor, or that can be from a psychiatric nurse practitioner or a psychiatrist. So I think, when in doubt, when nothing else is working, then for some people, especially right now, they are going to need professional help to help them kind of get over the hump.
Mm-hmm. Mm-hmm. Thank you. Great ideas, really wonderful ideas. So we are just a couple minutes from the close of our discussion. Is there anything that you want to add, Dr. Schreiber, that I didn't ask you before I move to Dr. Miller for some closing remarks?
I just kind of want to remind people in summary that although times are hard and we are under strain as a society right now, we really can build in new routines. We really can use healthier coping skills and good self-care. And that's how we can take care of our bodies, our minds, and our spirits.
Mm-hmm. Great. Thank you for your comments tonight. Really meaningful and important stuff. Dr. Miller, any closing comments before the end of the webinar?
Sure. So I just want to mention as well that it's very important that everybody continues to seek medical care when they need it. We can't neglect ourselves, and you have to, stay connected to your primary care doctor. And it's been mentioned, certainly people can have video conferencing if you can't go in and see them directly, but really, really important to take care of yourself. And if you do need acute medical care, one of the powers of the testing strategies that we have now is that's allowed us to, when you do have to enter back to the hospital again, we have rapid testing ability now, and we can cohort patients into areas that are safe and test people when they do have to come in and put them in a COVID-free environment, which is really important, and allow people to get their care. And we have now systems in place where if somebody has to have elective surgery, they have to get pre-admission testing before, including a COVID test. So we have good strategies available that we're utilizing that are allowing us to, continue business as usual in some places. So very important to keep that in mind and know that those services are available to you and that you have to take advantage of them, especially when you need them. And the same goes for preventative services too, with your mammographies and colonoscopies. And, these outpatient centers have developed good strategies to keep people safe. They'll call you in when they're ready. You don't have to sit in a waiting room. So we have good strategies and that we do employ, but it's very important to remember to keep all those things in mind when we go forward during the pandemic, which is obviously not over yet. And I just want to give a pitch one more time to the importance of mask wearing. I'm a big mask guy, and put your mask on and keep it on when you need it. And you do need it a lot when you go out of your house. So remember that, okay? It really works.
Thank you both. I learned so much from both of you tonight, and I'm sure that that people who are logged on to the webinar feel the same way. So I just want to end by saying that all of everyone who registered for the webinar tonight will get a recorded copy of this, and there'll also be some contact information shared so that you can reach out to the three of us if you have additional questions, if anything comes up. And just on behalf of my colleagues tonight, I just want to wish everyone a safe and happy holiday season. Thanks for tuning in.
Thank you very much.
Thank you.